everyone, welcome or welcome back to the channel, that is AMS MBBS lectures. In today's session we are going to continue the same topic, that is HIV and AIDS under CVS Microbiology, and this is going to be the third part wherein I'm going to describe the course of the HIV infection. In the second part of the video under pathogenesis, I have let you all know the stages of HIV infection under course of HIV infection. Yes, so in the second part, I have just mentioned the names. Right now, we are going to go into the details of individual stages, guys. Okay. So as seen in the previous video, we have different types of disease progressors, of which the majority of them are typical progressors. Okay, that is, they are going to develop the HIV, the primary HIV infection will develop into AIDS within a span of 10 years. Those are your typical progressors. So right now, the course of the HIV infection that I will be describing in 5 stages would be with respect to the typical progressors. Okay. Next thing, so these are the 5 stages which I mentioned in the previous video also. But right now we are going to go into the details of each and every stage over here. Okay. Starting with the very first stage, that is acute HIV disease or acute retroviral syndrome. In this, suppose a person is having the HIV infection and a person contracted the HIV infection over here, and because of the HIV infection, what will happen? Initially, this HIV virus within the body will be carried to the lymph nodes, and it will be carried to the lymph node as well as to the lymphoid tissues. Okay, as well as to the lymphoid tissues, where it will be multiplying within the T cells. Okay, it will multiply inside the T cells. It will multiply inside the T cells. Specifically बोलूंगा तो CD4 T cells के अंदर it will start multiplying. Now it is this HIV infection, guys, that is going to destroy. After some time multiply कर रहा है T cell के अंदर, and then after some time it will start destroying, it will destroy the infected T cells. Okay, it will destroy the infected T cells, so it will start to destroy. And since now I'm saying that the HIV virus is inside the T cells and it is not destroying the T cells, matlab the HIV is entering inside the bloodstream. So can I say that is your HIV virus spills over into the bloodstream. Now virus entering inside the bloodstream, what is the condition referred to as? Virus inside the blood, and this is what is called as your primary viremia. This condition is what is called as your primary viremia. Okay, that means we are having your virus inside the blood, and this condition is also resembling the acute mononucleosis. Therefore, it is called as your acute mononucleosis like syndrome. And acute mononucleosis like syndrome. Okay. And also remember, while this is happening, this thing is basically coinciding. This primary viremia ka phase is coinciding. Okay, it coincides with something called as your flu-like illness. That takes place in nearly 50 to 75% of the patient. 50 to 75% of patient would be having this flu-like illness that takes place nearly 3 to 6 weeks after the primary infection. 3 to 6 weeks after the primary HIV infection. Okay. And while this all thing is happening, as I mentioned over here, that it is destroying the T cells को destroy कर रहा है. So can I say that is what will happen to the number of the infected T cells? What will happen to the number of circulating CD4 T cells? What will happen to the number of this thing? If the HIV is destroying the T cells, okay, they are destroying the CD4 T cells, so there will be a significant decrease. They will decrease significantly. Clear from this thing? This much is very much clear, right? So this was all about the first stage, guys. Now let us have a look on the graph that is explaining the first stage. Okay, so now let me orient you to the graph over here showing the same first stage. Okay, so first of all, my first time dekh rahe ho, let me orient you. So on the left hand side we have the number of CD4 T cell count, which is represented by the blue line in the graph. Then on the right hand side we have the plasma viremia titer. Okay, in simple terms it indicates the amount of virus present in the plasma, guys. Okay, and it is shown by the red line in the graph. And below over here we have the timeline. Okay, below here we have the timeline. Okay, so let's understand what are the changes that are taking place in the first stage. So abhi right now I described you that it is the CD4 T cell count which is going to decrease, है ना? So moment there is a primary infection taking place, we are seeing that your CD4 T cell count is decreasing. Yes or no, your CD4 T cell count is decreasing. So CD4 T cell count is decreasing, and जैसी CD4 T cell count is decreasing, why it is decreasing? Because it is the HIV that is destroying the T cell. Therefore, the CD4 T cell count is decreasing, and because of that, the amount of virus is increasing in the blood. Yes or no? The red line, can you see it is shooting upwards? Okay, so there is an increment in this thing. So if I am seeing CD4 T cell count decreasing, plasma viremia titer increasing, this is what is called as the first stage, that is your acute HIV disease or acute retroviral syndrome. Okay, let's move on towards the second stage, that is the asymptomatic stage or the stage of clinical latency, guys. Okay, so in this stage, what is happening now? Right. अभी देखो first stage में we all had a look that virus is entering inside the body, it is multiplying in the T cells, it is destroying the T cells, therefore CD4 T cell count is decreasing and the amount of virus in the blood is increasing, that is viremia is coming into picture and patient is having a flu-like symptom. Now what is the immune system of our body doing? So initially, guys, for the initial 1 month, immune system takes time for it to develop an immune response. So I am saying over here that is within a span of 1 month. Okay, within a span of 1 month your immune system will develop an immune response. Okay, so it will develop an adequate immune response, and this immune response is contributed by both the cell mediated as well as the humoral immunity. Okay, by both cell mediated immunity, cell mediated immunity, as well as your humoral immunity. We know cell mediated immunity means which cell are coming into picture, and humoral matlab antibodies are going to come into picture. Yes or no? So when it comes to cell mediated immunity, you should remember it is the HIV specific CD8 T cells, okay, that will come into picture. And when it comes to humoral immunity, we all are having the HIV specific neutralizing antibodies, okay, that will come into picture. So we have the neutralizing antibodies. Okay, so these are the two things that are contributing the immune response, guys. Okay, and please remember that because of this immune response there is going to happen two things. जो stage 1 में जो changes हुए थे, this immune response will try to reverse those changes. It is going to decrease the viremia. Okay, it will decrease the viremia, so it will drop down, the viremia drops down, guys. ठीक है, viremia में decrease होगा. So viremia is going to decrease, यानी कि amount of virus present in the blood is going to decrease because of the immune response. And also, guys, the CD4 T cell count has decreased. Yes or no? So now that CD4 T cell down, okay, will bring back to the normal. Okay, will become back to the normal levels. So CD4 T cell count is becoming normal. Okay, this count is becoming normal. So these are the changes that are going to take place within the second stage, guys. Okay, now please remember this important point that I want to highlight with respect to the second stage, that this stage over here that we are describing, it is a state of, or it is a stage of clinical latency. Okay, it's a state of clinical latency, and but not a state of microbiological latency. Okay, but it is not a state of microbiological latency. What do you mean by this thing? the immune response जो है, it is not capable of completely clearing or destroying the infection. Okay, so it is not a of the virus. Okay, so now what do we mean by this statement, guys? ठीक है, clinical latency का मतलब होता है that is the patient has become asymptomatic but still the patient is having the virus. So the इसका मतलब ये होता है that is the immune response that we have generated over here, the immune response that the body has generated is not capable of clearing. Okay, it cannot clear the HIV infection completely. Okay, it is not able to clear the HIV infection completely, and therefore your HIV is going to persist. Okay, HIV persists in the lymph node. HIV virus जो होता है, it is persisting inside the lymph node and it continues to replicate So see, clinically the patient is becoming asymptomatic because immune system has came into picture, but microbiologically the virus is still persisting in the lymph node and it is continuing to replicate. Okay, it continues to replicate, guys, at a higher level. Replication चालू ही रहेगा. That is the meaning of this statement, that it is a state of clinical latency but not microbiological latency, because virus is still there, it is still replicating. The only thing is that it is not able to manifest any symptoms, guys. Okay, that is the reason this stage is a stage of clinical latency and not a stage of microbiological latency, guys. Okay, one more point, what is the duration of this second stage, guys? So the duration of this phase is variable. So duration of a clinical latency or asymptomatic stage is a variable. Okay, on an average you can say that it is going to stay till like 10 years tak rehta on an average, or it you can say that the range is from few months to 30 years. Okay, few months to 30 years is the range of this stage, guys. Okay, now once the latency, once this 10 years or whichever duration के latency period रहता है, once the latency has disappeared, okay, I mean to say once the latency is broken, once the latency is broken, guys, the disease progresses rapidly. The disease progresses rapidly, and if the patient is not taken care of or if the patient is left untreated, the patient may land up into AIDS, and that is what is called as over here, it will quickly, the patient may die. Okay, the patient dies within a span of 2 years. Okay, within a span of 2 years the patient will die if left untreated. This is very important to write, if left untreated. Understood? This was all about the second stage. Okay, so second stage में क्या हो रहा है? Let's have a look on the second stage over here. That is, we are seeing that is your, this thing is increasing. Can you see the CD4 cell are increasing? And because the CD4 T cell, because of the appearance of the immune response, CD4 T cell is increasing and the viral load is decreasing. So you can see in the graph very clearly कि second stage में क्या हो रहा है? That is your viral load is decreasing, CD4 T cell is becoming normal, guys. The CD4 T cell count is becoming normal, viral load is decreasing. That is the second stage. That is the asymptomatic stage or the stage of clinical latency. Okay, then brings into picture that is referred to as your next stage, that is called as your persistent generalized lymphadenopathy, guys. Okay, now please pay attention that this stage is something that is not seen in every individual, guys. Okay, so over here what happens is patient, okay, as I'm saying कि clinical latency का stage था, the patient is asymptomatic only. ठीक है, so most of the patient जो होते हैं वो आपके asymptomatic stage में ही होते हैं, they are asymptomatic only. Okay, now only in nearly 25 to 30% of the patient, they can show a lymph node involvement. Okay, in them the lymph node gets involved or they may get enlarged, resulting into this persistent generalized lymphadenopathy. ठीक है. Now why lymph node का involvement हो रहा है? The reason is very simple, because where is HIV replicating? The HIV is replicating inside the lymph node only. So most of the patient asymptomatic ही रहते हैं. Only 25 to 30% patient will show a lymph node involvement, and that condition is called as persistent generalized lymphadenopathy, guys. ठीक है. Now how do you define this condition? Let's have a look on the definition of PGL, guys. ठीक है. So you are going to say that if the lymph nodes are enlarged, okay, so if the lymph nodes are enlarged, so enlarged lymph nodes, how much enlargement? So they are increasing more than 1 centimeter in size, okay, in two or more non-contiguous sites, okay, in two or more non-contiguous sites, and that too, this whole thing is going to persist, that persist for at least 3 months, then only you can say this is a case of persistent generalized lymphadenopathy. So I'm saying that is, if the size of the lymph node is increasing by more than 1 centimeters, it is involving two or more non-contiguous lymph node sites, and also this whole duration is persisting for a duration of 3 months or more than that, we say this is a case of persistent generalized lymphadenopathy. Now, one important point that I want to add on over here is that always rule out the other causes of lymphadenopathy. Always rule out other causes of lymphadenopathy, है ना. इसका ये मतलब नहीं होता ना always like lymph node enlarge हुआ है, HIV का patient है तो it is PGL only. It can be because of some other causes also, guys. So always rule out the other causes of your lymphadenopathy. Other causes such as, you can remember one of the example as your lymphoma. ठीक है. Yes, lymph node का enlargement हो सकता है because of lymphomas. Okay, so this is all about the third stage. Let's go towards the fourth stage, that is called symptomatic HIV infection or AIDS related complex. Okay, now see, now this is the stage where the latency is broken, guys. तो वही लिखा हुआ है यहाँ पर. So I'm writing the same thing over here, that is after a variable period of latency, after a variable period of latency, now once the patient is coming out of latency, yani ki latency is broken, guys, what will happen? The first important thing that is going to take place is a drop down in the CD4 T cell count. Okay, so your CD4 T cell count will again begin to drop. So a decrement in the CD4 T cell count indicates that the variable period, okay, that latency has been now broken, and your CD4 T cell count has begun to drop down, and it is at this point, okay, when the patient will start to develop constitutional symptoms. The patient develops constitutional symptoms. Very important. What are the constitutional symptoms of HIV? So constitutional symptoms develop करेगा, and those includes patient would be having an unexplained diarrhea. Okay, unexplained chronic diarrhea hoga. What do I mean by chronic diarrhea? Means a diarrhea that is persisting for more than 1 month. Okay, a diarrhea that is persisting for more than 1 month is called as chronic diarrhea. So uska reason we don't know, that is what is called unexplained chronic diarrhea. Patient would be having a weight loss hoga patient ko, ठीक है, that too of more than 10% weight loss. Patient may complain of fatigue, malaise, and night sweats. Okay, and the patient may also experience night sweats. Okay, and lastly, we can also write that the patient may also have some mild opportunistic infections. Again, I'm repeating, it is mild opportunistic infections, and one of the examples that the patient may have is of oral thrush. Okay, so what I'm saying, symptomatic HIV infection or age-related complex is the fourth stage where the latency is coming to end. The latency period is coming to end. CD4 T cell count decreasing, patient developing constitutional symptoms like chronic diarrhea, weight loss, mild opportunistic infections like oral thrush. Let's have a look on the graph explaining the same stage. Let's understand it through the graph point also. So over here, can we see that is your latency over here, this thing over here, the CD4 T cell count is nearly normal. Yes or no? Now after a long period of time, what is going to happen? Can you see your CD4 T cell count over here? We can see that the CD4 T cell count is decreasing, and of course your viral load is going to start increasing, and it is at this point, okay, it is at this point where your CD4 cell count is going to decrease, viremia is increasing, patient will start developing your constitutional symptoms, guys. And this whole point over here is indicating the fourth stage, okay, it's indicating the fourth stage where the patient is having, okay, it is the symptomatic stage of HIV, guys. Understood this graph? Okay. Now let's move on towards the last stage, the ultimatum, that is your AIDS, acquired immunodeficiency syndrome, guys. Okay. So in this stage, this is considered to be as the last stage. Every one of us knows, yes. So it is the advanced end stage of HIV. Okay, it is considered to be the advanced end stage of your HIV infection. Over here, what is happening? Okay, over here there would be a rapid fall in the CD4 count. Okay, a rapid fall in the CD4 T cell count. Okay, so your CD4 T cell count is rapidly decreasing, and that to the level of less than 200 cells per microliters. Okay, so this is the amount by which the CD4 T cell count is going to decrease. It is less than 200 cells per microliter. And also, what will happen to the viral load? T cells are decreasing, viral load will increase, yes or no? So this stage is having an increase or a high viral load is what is this stage characterized by. Okay, a high viral load. Next point, what will happen to the lymphoid? Okay, what will happen to those lymphoid tissue where the HIV was replicating? Please remember, there would be a complete destruction of the lymphoid tissue. Okay, so lymphoid tissue jo hote hai, they are destroyed, they are completely destroyed, and it is replaced. Okay, it is replaced by the fibrous tissue. So replacement of the lymphoid tissue by the fibrous tissue, this thing also happens in the last stage. Okay. Next thing, what do you expect during this stage? Very important thing, that is patient will start developing opportunistic infection, and this thing is secondary to the profound immune suppression. And it is AIDS. AIDS matlab your immune system is going to suppress very profoundly, very significantly. There would be a suppression of the immune system, and because of this thing, secondary to the suppression of the immune system, there would be development of different opportunistic infections, guys. Okay, so this point is clear. And please remember, this opportunistic infections, okay, depends the appearance of opportunistic infection depends upon the number of CD4 T cells. Okay, jitna decrease hoga uske basis pe you are going to have different types of opportunistic infection. We're going to look at a graph with respect to this thing. There is a graph explaining this point. Next thing, guys, the patients are going to develop, एक minute. So next thing over here is that the patient is going to develop neoplastic condition. So there is development of neoplastic conditions, or you can say neoplasia. Okay, and the example that the patient may have some neoplastic conditions such as your CNS, lymphoma, Kaposi's, sarcoma, and these are some examples that you can remember. Okay, and then next thing that you can quote over here is the patient will also develop, there would be development of a direct HIV induced manifestations. Okay, direct HIV induced conditions. Okay, direct HIV induced conditions or manifestations, and the example of this thing that you can remember is your HIV encephalopathy. HIV encephalopathy. Okay, let's have a look on the graph and let's understand what is happening over here. So over here you can simply see that is now after the constitutional fourth symptom के बाद क्या हो रहा है, can you see a rapid fall, okay, in the CD4 T cell count? It is decreasing very significantly, and also the can you see the viral load, it is also elevating very high. So CD4 T cell count decreasing rapidly and an elevated levels of this thing with the appearance of your opportunistic infections over here, and ultimately if not treated, death is something that is going to take place over here. Okay, next graph over here explains you the appearance of opportunistic infections, okay, with respect to the CD4 T cell count, guys. Okay, so I am saying that is जैसी CD4 T cell count is becoming 500 के level पे जा रहा है, what is happening over here? You are getting some opportunistic infections like your bacterial sin infections, herpes simplex virus infections, fungal infections. Or come over at 400, you will be getting Kaposi sarcoma, one of the neoplastic condition. At when the CD4 T cell count is decreasing to 300, you are getting hairy leukoplakia and tuberculosis jesi condition. And when it is decreasing to 200, you are getting your PCP, cryptococcosis, toxoplasmosis, and lastly at 50 level, you're getting condition like MAC, CMV, and lymphoma jesi conditions. Okay. So what is the conclusion? That is in the last stage of infection, guys, your opportunistic infection is dependent upon the number of CD4 T cell count. And this is what this graph is explaining you, okay, and the dependent on the CD4 T cell count. Okay, so all these stages are covered, the details of each and every stages are covered. So that is it for this session, guys. If you found this content useful, then do like, share and subscribe to the channel. Thank you so much for watching. If you have any questions or queries, then do comment down. I'm there to answer it. See you on the next one. Bye bye.